In 2017, I went with ASH, the American Society of Hematology, to Tanzania as a health volunteer. And I spent a couple of weeks teaching as what is called in Tanzania super specialized hematologist in morphology and bedside teaching. And for me, this was a life-changing event. So I decided to go back there on a regular basis. I managed to get funding, initially small funding, but then a big UK NIHR grant, which essentially is running in Uganda and in Tanzania in 5 different sites. We're recruiting children with suspected Burkitt's lymphoma or other EBV-driven lymphomas. We have recruited already almost 400 children, and we are now analyzing the circulating tumor DNA because, and we've developed assays to do this. We've put in place next-generation sequencing capability for circulating tumor DNA, both in Uganda in the national lab in Kampala, and in Tanzania we've created a social enterprise to sustain the next generation sequencing capability beyond the end of the program grant. So the idea is, or not the idea, but what we have done already now in the second phase of this program is implemented this test into routine practice, and by also reporting results back. And the turnaround time of getting from taking the blood sample or from the children in often very remotely located hospitals to having the results ready is on average about 2 weeks, but sometimes it takes a lot longer because of transfer problems. But we have managed to also provide diagnosis as quickly as 6 days from northern Uganda to the capital in Kampala. So we're very proud to say that we think that this is a new way of diagnosing these children more quickly. In particular, it means that children with suspected lymphoma don't necessarily have to travel long distances. Families don't need to leave their other children alone during that time when they're traveling. And because treatment can obviously be given locally, it's the diagnosis that is often only available in a central tertiary cancer hospital in the capital. More importantly, even there's not enough surgeons to take biopsies. There are not enough pathologists to look down the microscope and perform immunohistochemistry. Very often there's quality control issues with immunohistochemistry, so we are actually providing here a quick alternative, at least for the cases with Burkitt's lymphoma.